everyone, my name's James and I'm one of the vets at the Unusual Pet Vets. I've got my beautiful friend Dusty here with me today and she's going to help out myself while we have a quick chat about rabbits. One of the things I wanted to start by talking about is, you can talk in a minute. One of the things that I wanted to talk about to start with is how often you should bring your rabbit in for a health check. And in general, for most healthy rabbits, we recommend a check over every 6 months. That allows us to tie that into their vaccination because that's when the vaccines are due, and also allows us to give them a top to tail check over to make sure that they're as healthy as they can be. What that involves is you'll come in, we'll have a discussion about their diet and their husbandry and how they're set up. We'll then examine your buddy and check them over. We'll start at their nose, check out their teeth, check out their ears, have a feel around their whole body, and obviously listen to their heart and their lungs as well as their abdomen, and just make sure that they're in the best health they can be. If there's any issues that we identify, then we deal with them then, and we can do things like clipping nails or anything like that at those times as well. From there, if everything's looking good, we then will vaccinate your buddy, and then that basically just allows them to have the best protection they can against calicivirus, which is often a fatal virus if they do contract it. And so we don't want them getting that. The way that that's spread is a few different ways, but one of the main ways is via insects. So even indoor rabbits are at a little bit of a risk of getting the calicivirus, and so it's much better to have them covered because it means that you can do everything you can to keep them healthy. And that's about all that's involved in the health check. So we do that, and then if everything's doing well, we aim for another 6 months. We just make sure you've got your diet and your husbandry all set up, and if that's all good, then we keep that at 6 monthly. If there's any concerns, obviously we get you to come in between, and we can deal with those problems as they arrive. The other big thing that's really common about rabbit preventative care and really important is desexing. And so we know that female rabbits have a really high risk of developing uterine cancer, and so almost 80% of rabbits that are over 2 years of age will develop uterine cancer, and so we want to be making sure that they're desexed, and we're minimising the risk of that, or we're eliminating the risk of that occurring before they sort of hit that age. We also know that it's important for boys as well. They can suffer from things like testicular cancer and issues around there, but also it's very important for behaviour. A lot of male and tiger bunnies will display some unwanted reproductive behaviours towards sometimes yourself or your feet or a ball or another bunny. And then obviously the other important reason for desexing is obviously to prevent population control. We don't want to have an abundance of bunnies that we can't find homes for and those sort of things. So it's important from that point of view as well. So common things to look out for is if they're showing any symptoms of illness in between those sort of visits. If they're not eating well, if they stop eating, they're quiet, if they're hunched up and sore. Hello mate. If there's any sneezing, anything like that, any diarrhea, any problems like that at all, then you want to be bringing them in between. I think that's all from us, so hope you enjoyed our little video. Check out our website and have a look around the pages, and if you need any further information, don't hesitate to get in touch, and me and Dusty look forward to seeing you soon. Thanks so much.